An emerging and troubling trend inside of what researchers are following in the medical industry, an emerging trend of an increasing rate of colorectal cancer in young people. And if this sounds familiar, it's because it has been in the news recently. Actor James Van Der Beek recently passed away on February 11th of this year at the age of 48 following a battle with colon cancer. Chadwick Boseman, the actor, died at the age of 43 following battle with colon cancer. We turn now to Dr. Dennis Choat, colorectal surgeon at City of Hope Cancer Center, Atlanta, who joins us now live. Doctor, we appreciate your time. Are we seeing an increase in the rate of colon cancer and colorectal cancer diagnoses in younger and younger patients?
Well, we certainly are, and it's very troubling to us in the field. It is something that we have noticed over the last decade or so that we're seeing much younger patients diagnosed with colorectal cancer, and we're trying to determine, what's the cause of this. And there are two real categories of colon cancer occurrence. One is genetic, so certainly if you have a family history, particularly first degree relatives, mother, father, brother, sister, who have had colon cancer, then you should certainly be screened at age 45, or the guideline there is if you have a relative who is diagnosed, say, at age 50, then you back up 10 years from the age of their diagnosis and begin your screening. So whichever comes first. And then the other category is the sporadic, or the ones we don't really know why it occurs. It's the more common cause of colon cancer versus family history, but also the most puzzling as to why this is happening.
Doctor, you used the word puzzling there. Do doctors and researchers have any sense of why more and more patients are being diagnosed at earlier ages?
Well, there are several working theories there. One is the diet that we have, particularly eating processed foods, um, a lack of activity, which both then can lead to obesity, which is a known risk factor, as well as smoking is also a risk factor, and alcohol consumption, certainly excessively, is a risk factor. So we think all these together are adding to the earlier occurrence. And one that's really mentioned more in the scientific data is post baby boomer um, generations. There was a lot of antibiotic kind of overusage without proper stewardship back in the 70s and 80s, which we feel changed the microbiome or the makeup of the GI tract. And that has led to sort of a dysbiosis, we call it, to cause earlier polyp formation and then cancer formation.
Doctor, for somebody who may be listening into this conversation, is young in their 30s or 40s, and rightly is hearing this and maybe is a little worried, what steps can they take right now? What steps should they be taking right now to, as best they can, protect themselves?
Well, again, proper diet, exercise, weight management, and just don't don't ignore symptoms. Most of the symptoms associated with this would be abdominal pain, any type of bleeding, rectal bleeding, or a change in bowel habits. And certainly don't ignore this or feel that it's too trivial or it can't happen to me at this point in my life, and just let it go. Seek your physician's advice and have the appropriate testing and screening.
And when should people start getting screened? What age should people start getting screened at?
So currently, the task force guidelines say age 45, and that's down from age 50 from a few years back. But again, age 45, or if you have symptoms, you're no longer screening. If you have symptoms, it becomes more of a surveillance. Um, but the um, the main thing is talk to your doctor about the symptoms you've noticed and don't ignore it, and seek the appropriate help. And screening guidelines are essentially colonoscopy, which can be done at 45 for average
And it looks like, Dr. Choat, we may have just lost you there. But yeah, I think we lost Dr. Choat. But we were just about to wrap up. And Dr. Choat, if you're still listening in, if you're able to hear us, thank you for your time and your perspective and important advice for young people, younger and younger adults, to pay attention to this trend. As you heard the doctor say, pay attention if you are feeling symptoms. Talk to your doctor if you think you're feeling symptoms, and follow the guidelines on when it is time to start getting screened. Most importantly, Dr. Choat, again, saying, don't keep this stuff secret. Talk to your doctor so that if something is going on, they can get you pointed in the right direction to start getting treated and fixed up as quickly as possible. Our thanks to Dr. Dennis Choat, colorectal surgeon at City of Hope Cancer Center, Atlanta, for that important conversation and those important tips.